doctors.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160. It's always exciting when we get a chance to meet another new physician for the Indiana Regional Medical Center, and we do that this morning with Dr. Darrell Rubin, who is a cardiologist, and joins us this morning. Our conversation brought to you by Marcus & Mack, a law firm representing injured people. How are you?
I'm doing well. How are you?
Wonderful. It's good to have you in the studio with us here today.
Glad to be here.
In practice, IRMC, the IRMC physician group, in the office with Dr. McDowell. Who all is in that cardiology office?
Dr. McDowell, Dr. John Gregg, Melissa Duncan's one of our PAs, Julia Bosco, and Kimberly Pierce is also one of our PAs. And, of course, we have a lot of staff that supports everything.
Yeah.
Without them, things grind to a halt.
Yeah, I want to start there because you're absolutely right. It takes not only the doctors themselves, the PAs, the various different support services. And when we talk about cardiology at IRMC, you talk about a team approach. It really is, isn't it?
Yeah, it's a lot of people that are involved.
Yeah.
It's not just the doctors, but, there's a host of people who support all the things that we do. Not only in the hospital, but in the clinic. We have sonographers. We have 3 sonographers who do a wonderful job keeping patients comfortable and doing quality studies. The cath lab team, as you know, is very important. They take very good care of our patients. And then, of course, the whole hospital is sort of geared towards it, and we take full advantage of everybody that's there. And then in the clinic, of course, patients come and they feel like you're coming to see the doctor, but they actually see a lot of people first. You have to see our front office staff, to get you scheduled and registered and take your calls and all those things. And they're very important. And then our technicians and our medical assistants bring you into the office once you get there. They get your vital signs and look at your medication list, which is huge. It's a very important part of what we do is having an accurate medication list, and that takes time. And they do their work very diligently and very well. So I appreciate everything they do. And then the PAs, the doctors, we see you for the visit. And we talk, and then after the visit, there's a whole bunch of stuff that happens too.
Yeah.
If you have studies and diagnostics, like we end up with the reports, but that has to be generated and transmitted. And so it's a pretty well-oiled machine. Dr. McDowell, Dr. Gregg, done a great job in putting it all together, and it's worked well in this community for a long time.
Follow-up care is so much a big part of any cardiology patient's history because you do begin a history when you're going to see the cardiologist. Let's talk about from the very beginning of the process. Who should be seeing a cardiologist?
So in general, it's sort of start at the patient level. Now, it used to be that you had to have a referral from your primary care physician in order to end up in the specialist office. That's less true today. But in general, that's how it starts. So people go to their primary care physician. They say, okay, I have a complaint. Primary care physician may do some diagnostic study. They may talk with the patient. They may try therapy. And then they say, well, this isn't, really going the way I thought it would go. Let's have you see a specialist. Right? Or they'll identify right up front, you know what, this is something you got to go see a specialist for. So we'll get you scheduled. Yeah. And then there's, sort of the last group of patients is people who self-refer. They say, I'm having chest pain, I want to see a cardiologist. So they call, they get an appointment, they come in.
Generally, people are experiencing some sort of symptom, though, before they say, time to visit the cardiologist.
Exactly.
Yeah.
Exactly. It's something, and that's, they have something that is bothering them that brings them in. It's not like primary care where you go in and sort of like, they're sort of doing the wellness exams, that kind of thing. Most people end up in our offices because they have a complaint.
Yeah, so you've got a bit of a problem. You want to get it checked out, and you've either been referred there by another physician or there's been an event. In many cases, there's an event that happens, and all of a sudden somebody finds himself going to a cardiologist who has no experience and has no expectations. What do I find out? What happens when I go to the cardiologist? And it's a process.
It is. And it's very well defined. We spend, that's why medical school is so long, because you're spending time learning this process, and it really all starts with the story. Patients come in, they tell us a story. What's going on? And it's an old adage that I learned in medical school, and I don't know where it started, but it goes, if you listen to the patient long enough, they will tell you what's wrong. So there, that's how you start. You tell me what's going on, and then I ask you some questions to sort of draw out more information. about the situation. And then I combine that with some clinical data, like my physical exam, labs, diagnostic studies, and then we sort of put it into this black box called clinical reasoning, and out comes the plan.
Okay.
Right, so we implement the plan, and then it goes back to the story. So you came in with a problem, we came up with a plan, implement the plan. Now you go out, and then we see how are you doing with the things that we've decided to go forward with, and make adjustments going, from that point.
We're talking with Dr. Darrell Rubin, new cardiologist at IRMC, here this morning on Indiana in the Morning. Let's talk about some definition of terms. Heart disease versus someone who maybe has had a heart event. Can they be the same thing, or do they necessarily have to be the same thing? If you've had a heart event.
Yeah, so that's interesting. I'm a huge fan of defining terms.
Sure.
We say in our family, language is important. And on some level, sort of heart disease and heart events are the same thing. We kind of shy away from this word disease because it sounds like stigma. But if you have a heart event, there's something underlying that led to it, and that needs to be addressed. And in my relatively short career as a cardiologist, so the way we think of how heart events are categorized has changed quite a bit. But at the end of the day, it really comes down to taking good care of yourself. Diet, exercise first. If you have a heart event, we have medicines to that. Heart events can be uncontrolled high blood pressure, for instance. That's a huge one. Diet drives a lot of that. Some people have problems that are not diet related that contribute to high blood pressure, but we get to that in the course of our sort of clinical process.
Sure. We think about people who have suffered heart events. Heart attack is, of course, the word that we hear very often. Whatever that heart event might be, we hear about heart blockages,
right?
And we have to deal with those. And when you talked about the team approach, the cath lab is a pretty amazing place over there, isn't it?
It is. It absolutely. When you think about what they do every day, day in, day out, with very low complication rates, it's quite amazing. Putting small tools inside of people's hearts, inside the arteries that feed their heart's blood, and intervening when necessary, putting stents in, and then having those patients leave and go back to their lives. Is pretty amazing.
Yeah. One of the interesting things to me is a heart patient can be 20, 30 years old. We think more traditionally of a heart patient being somebody who's past the age of 70, but that is not necessarily the case, and in many cases, it's just absolutely not the case.
Right.
Living your life with having had a heart event, and then moving forward and resuming what you consider to be your full activities, it's absolutely possible, isn't it?
Completely. It's I like to tell people in the beginning, and after that too, it's based on your tolerance for symptoms. If you're not having any symptoms, that's wonderful, right? You want to be careful. Anytime you've had a heart event like a heart attack or a cardiovascular event, I'll say maybe you had a stroke. You start with, for instance, cardiac rehab. That's a great place. It's monitored. You exercise in a monitor setting, and they ramp up the intensity in a stepwise fashion, and you get to see, how am I feeling? If you're not feeling well, you get immediate feedback. Right? You're like, hey, I'm not feeling well. Get the blood pressure, right? You get an EKG if you need it. Vital signs taken, that kind of thing. But then you get to sort of see, how well am I progressing, right? And then, as you finish cardiac rehab, for people who haven't exercised before, that's a wonderful beginning. Right, because then you can continue, and that is like that's number one prescription, diet and exercise, right? And so they're in that. People who are already exercising and doing well in that regard can end cardiac rehab and start to get back to what they used to do, all within their tolerance limit. Because I also like to tell people you're not in any rush. Yeah, there's no hurry, right? You'll get there eventually. Take your time, right? If it doesn't feel right, dial it back. Right. That doesn't mean it will never get back. Right. It just takes longer.
Sure.
Particularly as we get older. As I get older, my body just not as resilient as it used to be. It takes time.
Mm-hmm.
And once I accepted that, exercise was a lot more pleasant, and I wanted to do it more. Right. So I try to make sure that message is heard when I'm in the clinic, and trying to encourage people to exercise and eat right, take their medicines, that kind of thing. Look, we're not in any rush here.
Yeah.
We can get it done.
Yeah.
Just a little bit at a time.
That's a very, very good point too, because if you're not and you jump right into it, exercise can hurt.
Oh, yeah. For people who don't exercise regularly, before they have their heart event, it can be very, very discouraging. And point of fact, people who haven't had heart events and don't exercise regularly, when they start to exercise, it's so uncomfortable.
Sure.
And they don't want to do it. If they do too much, they can spend so much time recovering that they just, forget it, I'm done.
Yeah.
Right.
Yeah.
But if you do a little bit at a time, and I actually will recommend to people to do something regularly that may not even seem like exercise to them. Just get up in the morning and do gentle stretching, touch your toes, right? Lift your hands over your head. It doesn't seem like anything, but you get up in the morning, you do that a few times, and you go on about your business.
Yeah.
Right? And over weeks, maybe months, you might want to do a little more, right? Maybe one day you decide, you know what, I'm going to go for a walk. Right? Now, instead of going out, getting some new exercise clothes, brand new tennis shoes, just go out in your comfortable clothes and walk 5-10 minutes, come home.
Yeah.
That's it. That's how you start, and that's how you develop a habit that's sustainable.
Yeah.
And that's what you're looking for.
You're building a lifestyle.
That's correct.
Dr. Darrell Rubin with us here this morning. How long have you been at IRMC?
It's been a little over 12 weeks.
That's all.
That's it.
You're brand new.
I'm brand spanking new. That's great.
Where do you come from?
So I spent a number of years at Somerset. I trained at University of Pittsburgh, did my cardiology fellowship there, and medicine and graduate school at Case Western in Cleveland, Ohio.
Yeah. Has it always been medicine for you? Was that the dream when you were a young lad?
No, when I was young, I wanted to be an astronaut.
Oh yeah. There you go.
Yeah, I wanted to be an astronaut. There's a small thread of hope out there.
It could still happen.
Hey, Jeff and Elon are sending folks to space all the time. Maybe.
There you go.
Who
Could
knows?
Be you.
It's possible.
It
it's
could
possible.
be you.
Yeah, but medicine came up quick in college, and I was have a scientific bent, so I did a PhD, in cell biology was the work.
Oh yeah.
Sorry.
No.
Oh yeah, cell biology was the work, and I did that in conjunction with my medical training, and so I sort of bring that approach to all the things that I do. If we have a problem, let's look up and see what information is there, and then bring that to bear.
With the training that you've received, and we're running a little long, but I don't care. With the training that you've received, the various places that you've been, you come here to Indiana. We talked about the cath lab a couple of moments ago. You see the way that heart health is done here in Indiana. Is it as impressive as I think it is? I'm local. That's all I know is what's happening here. But having been elsewhere and seeing the way other people do it, is it really as well done here as it seems to be?
Yeah, it is. It is. What's even more impressive is that this hospital is independent. That is against the trend. Steve Wolf is committed to Indiana Regional being an independent hospital, and they're making it happen. They're bringing services here. And it's one thing, having worked in Somerset. I'm from rural Louisiana, so I get it. Services can be difficult to provide.
Yeah.
And in Somerset, certainly that was true. They had some core services, and in Indiana Regional, you have quite a few more services. So they're doing a wonderful job providing care for this community. Some things about cardiology care are standard, and certainly meet the standard for sure. They also have some things that are going to be the standard in the next few years. Already providing that here.
They're doing it here already.
They're already doing it here. Yeah. So I was really pleased to see that, and talking with the folks who are in a position to expand services. They certainly have their goals set high, and that's what you want.
He is Dr. Darrell Rubin. Thanks so much for coming in to visit with us today.
You're welcome. Glad to be here.
We appreciate it. It is the voice of Indiana County, WCCS 101.1 FM, AM 1160.